Today, December 1, is marked globally as World AIDS Day, in remembrance of those who have been lost to AIDS-related illnesses and to honor the 39 million people on earth who are living with HIV, as well as continue to remind humanity of the dangers of the public health scourge. The theme for the 2024 commemoration, according to the World Health Organization, is Take the Right Path, My Health, My Rights. For a quick conversation around the significance of all the global efforts to keep HIV/AIDS on the front burner, and have been joined here by Dr. Blossom Maduafokwa, a public health physician at Lagos University Teaching Hospital and public relations officer for the Association of Public Health Physicians of Nigeria, Lagos branch. Doctor, great to have you on this Live the Sunday Talk Show.
Thank you so much for having me, Dr. Bati.
Well, let's go straight to it. Yes. The significance of December 1, World AIDS Day.
So this day was actually, we started commemorating this day in 1988 because we realized that it was important to throw light on the things that governments, civil society organizations, and individuals can do to protect themselves against HIV/AIDS. So this is what we do today. We spread the message about what people can do to keep themselves safe and what we can do as a community to ensure that we completely eliminate this scourge in the years to come.
Well, the theme for this year is about rights.
Yes.
My health, my right. Could you talk us through that, particularly as the Director General of NACA was saying that people should avoid stigmatization. Exactly. People should avoid discrimination, and people should know their status. Well, I don't know how many people will walk straight to the hospital and say they want to know their status.
Yeah, so this year the theme is my health, my rights, because we realized that some of our key populations, some of our disadvantaged populations have a higher incidence and prevalence of HIV/AIDS. In fact, people don't realize that women are twice as likely to have HIV than men. So women are actually a disadvantaged group or population because of several factors, including socio-cultural factors, their ability to stand up for themselves in certain situations. So those things put people at risk. So this is why we're throwing the light on ensuring that people understand that your health is your right, and also to governments and civil society organizations to be able to make health accessible to everyone. Health is a basic human right. And when people have access to health, they're then able to advocate for themselves.
Well, but what do you think of government's efforts?
Yeah.
It's not enough to have an AIDS control agency. It's also about commitment at both the national and the subnational level. Even the campaigns have stopped. I don't see too many health campaigns in relation to HIV/AIDS around the states.
So you raise a very, very important point because, like we always say, there are things that individuals can do, but there are many more things that governments can do. And one of the ways that governments can ensure that we continue to reduce the incidence and prevalence of HIV/AIDS is universal health coverage, so that people have access to health care. There are individuals that don't even want to have anything to do with a healthcare facility because they're already saying we can't afford it. So that presents like a financial barrier to accessing health. So another thing that governments can do is knowledge sharing. So you're saying, oh, you're not seeing the campaigns as much as before. You're actually not wrong. You know, back then when people were saying, oh, HIV/AIDS is a death sentence, the communication was constant. But now that we have so many other preventive strategies, I think there's more of a focus on some of those strategies, including, of course, like you mentioned, getting yourself tested, including pre-exposure prophylaxis, that's available. Post-exposure prophylaxis is also available. And antiretroviral treatment is actually quite effective with very few side effects and allowing people to live longer with HIV/AIDS. So a lot of the messaging is focused on what we call key populations. People that do sex work, for example, individuals, mothers that have HIV, trying to prevent mother-to-child transmission. So a lot of the messaging goes to all those key populations that have a higher risk of contracting HIV.
Okay, well, stigma, part of the things we are addressing.
Yes.
It's about workplace policy. We have had at least about 2 cases in recent years where employers of labor, having discovered the status of certain persons, said they will not be employed. In fact, in one case, the matter went to court. The person insisted on his right to be given a job. But have we made any progress in that regard? How many employers of labor will knowingly employ somebody who is HIV positive or living with HIV?
So that's a great point you have raised, because you can't discriminate against an individual based on their HIV status. That is the law. However, the lack of knowledge, not just among the employers, but among the populace as well, people actually don't realize that it's their right to have access to employment, whether they are HIV positive or not. So this is some of the things that we need to do to educate not just the employers, but also the potential employees, that this is your basic human right.
But how much of a threat does religious belief pose, in this matter? Because there are persons who will tell you that a man must die or something.
Yes.
Even when doctors tell them, oh, take prevention, you can prevent and all that, they will say no. There's a way they want to go to heaven, and that a man must die or something.
Yes.
How do doctors deal with that?
So we hear that a lot. And the question is, you have to die of something, but how do you want that death to be? If you actually see someone that is dying of AIDS or is dying from some of these chronic diseases, it's for us, it's usually a game changer, because you don't realize how horrible that death can be. So you have to die of something, but how long and protracted do you have to suffer for before that death actually comes? So there are things that you can simply... We know celebrities like Michael Johnson, for example, the basketball player that was diagnosed with HIV, I believe it's almost 30 years ago, and he's living with the disease completely fine because he's on his antiretroviral treatment. So people can actually live very long and happy lives if they get tested, get treated, and stay on their medication. And the person will just even die of natural causes, for all you know.
In other words, you are saying HIV/AIDS is not a death sentence.
It is not a death sentence.
But it's better to avoid it if possible.
Exactly.
Okay. Well, as we begin to wrap up now, you as the expert, I would like you to speak to our viewers at home, specifically on this occasion of what is the 2024, and also to government, to individuals on this occasion, and also to government at both levels, national and subnational.
Thank you so much. So to individuals, there are things that you can do to actually protect yourself. So that's what we call general health promotion. So safe or safer sex practices. We have an interesting mnemonic that we use. It's called ABCD. So A is abstain if you can. B, be faithful. C, use condoms for protection. And D, take drugs or medication when you're diagnosed with either HIV or any sexually transmitted infection. Other things that you can do to protect yourself, pre-exposure prophylaxis. People don't realize that, particularly people that are at risk for HIV, like people that do sex work, you can actually have medications that you take to protect you or prevent you from getting infected. There's also what we call post exposure prophylaxis. If you feel you've been exposed to HIV infection within 72 hours, you can actually start with these medications that can prevent you from actually getting HIV infection. And to governments at the national and the subnational level, one key thing that we need to ensure is universal health coverage. Because when individuals have access to healthcare as a basic human right, individuals are able to freely come to healthcare facilities without risk of financial ruin. So universal health coverage is extremely important. Another thing that we can strengthen both at the national and the subnational level is primary health care. So primary health care is care that is available, essential, and accessible to most of the population and can handle most health conditions. And if we're able to strengthen primary health care, we're going to be able to widen our coverage of healthcare to our populations.
Well, thank you very much, Dr. Blossom Maduafokwa,
for
joining us on
me.
This Day Live, the Sunday talk show on today's occasion of World AIDS Day.
Thank you for having me.